Cross continues to fulfill its commitment of helping communities. It continues to serve the underprivileged by providing housing, livelihood programs, and health centers. For the housing project, efficiency is given top priority.
In this precast yard, we have two teams. The steel fabrication team. This team is doing all the cuttings of the steel bars, the tying, the making of the post steels. The second team is the precast post concreting team. So they make all those concreting of posts. The advantage of this precast yard is we make the precast post ahead of the construction of the house. So by doing this, we are shortening the construction of the house by around 3 days.
More than 300 workers have been employed to assist in the housing project. Challenges include delays in the delivery of the materials, such as gravel and sand, and training the workers how to do the work. Most of the workers came from neighboring towns and other places.
Kaya kung nagayada kayong pabahay, kano, kung lagyan pa balay mo, pa na lang nga, salamat nalaliwat ako ng baga mayada pabahay.
While many of these beneficiaries are very grateful to have started the construction of their new homes, most of these homes do not have partitions and without proper flooring. The bare concrete gets very cold at times.
For now, I guess we can say that we are progressing, even with some constraints.
The Red Cross team believes that communication is key towards successful implementation of the projects. The team has high hopes that they would be able to hit the target in the scheduled time frame.
We have heard that there are some suppliers also coming in from Mindanao and even in Luzon with the supplies of coco lumber.
Another area by which the Red Cross is involved is livelihood programs. Livelihood assistance is provided to communities that need it the most.
Ako po si Irene Culiera, nakatira sa Barangay Candahog, Balo, Leyte. Isa po akong beneficiary ng Red Cross na nakatanggap ng 5,000 pesos na yun ang pinuhunan ko sa pagbuko.
Almost all of the residents affected by the typhoon lost their means of income and are starting anew.
Ako ngayon ni Pablo Brasil, taga Barangay Malaginabot, San Miguel, Leyte. Adi nagkasawa, anak-anak, anak kasawa ngayon ni Gina Lynn Brasil. Adi anak-anak, anak tatay, anak nanay. Kami ngayon naghihimuin sipid. Amot ang pakabuhi ni. Ang gastos ini nga tugbo, papalit man namon. Ang gatos ini tag 40. Tapos an uway, istro, an uway, tagpiso, an istro. Kinuan man, renulyo man an istro. Dahil may tag 25 pesos.
People who receive financial assistance use the money for livelihood programs so they can get back on their feet and rebuild their lives.
Nakana po ako ng isang multi-cab at sa ngayon po nakabili na po ako ng washing machine, mga gamit bahay.
Bali 10,000 nga tanan. Ginkuhan kong hayop sir. Yes, mga tubonghan ni raw ko nagsula kong paghimong tangkal naruba na nga ni pagrubiliwat.
Health centers proved to be an urgent necessity for most communities.
Before, during the assessment, we came here to the community, asked whatever they need, really prioritize needs, and also involving the barangay officials and the local health units, especially the municipal health officer, and we asked them what they really need. And upon saying what they really need, we assessed that also, we revalidated it. And upon coming here in the community, we really saw that they don't have a birthing facility or a health facility, a functional health facility itself. So upon assessment, yeah, we decided to construct a new health facility as a birthing facility. we are also doing community-based health and first aid here, which is an approach to health promotion, disease prevention, and also improving the capacity of the community for future disaster. And yes, in doing the community-based health and first aid, we had our community assessment using different community assessment tools. And upon collation of all the data that we have gathered, we came up with top 3 health and safety problems in this community. Number 1 identified problem here is diarrhea, mainly because of the source of water. They don't have a potable source of water here mainly. The second is hypertension, which they could relate to lifestyle but mainly on the diet, because their diet here is mainly seafoods, which is high in cholesterol. And the third one is dengue.
This Tabunok Health Center, before the typhoon Yolanda made a landfall here, was just operated by one room, and were carrying out some basic health activities like immunization, family planning services, and some prenatal visits. And during the immunization on every Wednesday, the people used to sit outside in the scorching heat, which was very difficult for the parents as well as for the infants who used to come for immunization out here. Now, after the Yolanda made an landfall, and when we see the roof were completely damaged, and also the back part of this health facility was completely damaged, and in our health assessment we found out there is a need to rebuild these health facilities so that we can reach wider audience. Hence the new health facility had been designed and built according to the municipal engineer, which is now having 7 rooms, and it is now built back better and safer, as it also has what we call the birthing facilities. Here the catchment population is more than 6,000 people.
Rene Camposana, barangay chairman of Barangay Tabunok, says that it has been the community's dream to have its own birthing center so that women need not travel far to give birth and consult medical professionals.
Laking tuwa po ang mga tao dito sa Tabunok dahil sa wakas daw nandito na tayo, mayroon na tayong health center, mayroon na tayong birth center. At hindi lang dito sa Tabunok ang natuwa nito, lalo na rin yung mga malayo doon sa hinterland, doon sa bundok. Hindi na sila dapat pumunta pa ng Palumpon dahil napakalayo.
As communities continue their journey towards recovery, the Red Cross will be there to assist and inspire hope. Strengthening communities is possible with a heart for change combined with the right priorities.
At ngayon po, nagagawa ko ng bahay, hindi pa tapos, ongoing pa. Tapos at saka may savings din, konti. At maraming salamat po sa Red Cross dahil sa kanila, nagkaroon po ako ng hanap buhay.
Damo nga salamat ngayon ang mga taga Red Cross nga nakabulig iniham ani yung livelihood nga financial assistance.
Papasalamat kami nga Red Cross nga gintatagang kami suga dito nga sitwasyon.